Good morning, everybody. Welcome back to CBS This Morning. I'm Paula Thon.
And I'm Mark McEwen in for Harry Smith. Also coming up, what you need to know if you're afraid of anesthesia. Some reassuring news coming up for you on CBS This Morning. Are you afraid that you might not wake up, might even die if you go under anesthesia? Well, a survey by the New York State Society of Anesthesiologists, tough word to say this early, Howard, they found that you're not alone, but the technology these days is so good that out of 25 million procedures a year, fewer than 7 people, in fact, died. Dr. Howard Torman went to New York's Mount Sinai Hospital. He's here to tell us what he found. Anesthesiologist.
You get through that, you got it made.
Good morning, Howard.
Good morning. This is one of those things most people don't know a lot about. You know, if you've ever been operated on, I'd be willing to bet that you remember the surgeon, but what about the doc or the person who gave you anesthesia? You know, getting decent anesthesia is really a big part of successfully getting through the surgery. Yet most folks don't pay a whole lot of attention to it until you're on the operating table and you realize that you are about to go to sleep whether you like it or not.
Operation is all over. Okay? You did fine.
That's exactly what anyone who has surgery wants to hear, especially people like Nancy Marcantonio, whose last trip to the operating room was anything but fine.
I had surgery about 12 years ago. And I had an asthma attack when they administered the anesthesia. And they had to stop the surgery.
But a lot has happened in 12 years. Anesthesia is now a lot more sophisticated and less traumatic.
We'll use a new anesthetic agent, which has less reactivity, and you'll be much clearer post-operatively. We will, again, give you something in case you're wheezing. We want to match the patient, the anesthetic, and the surgery that they're having. You're doing fine.
For a lot of folks, the scariest part is being put to sleep.
Good.
But successful anesthesia is more than just going to sleep and waking up later.
A good anesthetic is one where the patient is rendered unconscious and in a surgical state without affecting their bodily functions, their vital signs, the blood pressure, the pulse.
Modern general anesthesia uses a variety of drugs in combination. Muscle relaxants, tranquilizers, something to keep you asleep, and since sleep alone doesn't keep you from feeling pain, painkillers. For someone like Nancy with a problem like asthma, things are a bit more complicated.
With this lady, we had to keep her very deep so that her airway doesn't react because we don't want her to have an asthma attack.
So you're using a lot of
anesthetic.
Patients worry about not hurting. Anesthesiologists take care of that easily, while at the same time using some pretty fancy technology to keep you safe.
Big changes in the monitoring, and what we have is we have really automatic monitoring. Blood pressure, all the vital signs are entered, and the respiratory parameters are entered right into the system automatically, and that's why we've reduced the deaths from anesthesia from 1 in 4,500 back in 1970 to 1 in less than 450,000 now.
One challenge is waking the patient up at just the right time.
One of the problems that we have at this point is it's taking a little longer to get the gallbladder out of the belly, and we've turned the anesthesia. We've timed it for the average. If this goes a little longer, our problem is keeping her adequately asleep.
What'll her recollection of this whole thing be?
Nothing.
If you've done it right.
Right. The art or the science is to balance the right amount of narcotics so that you wake up and are breathing well and don't have pain.
Nancy gets to the recovery room and in less than an hour is feisty again and hardly the worse for wear. Now, you've been operated on before. How'd this compare? How'd the anesthesia part of it compare to last time?
Well, evidently far more successful this time than last time.
How about waking up?
I'd love to.
You know, one of the things that makes some folks feel uncomfortable is you usually don't get to choose your anesthesiologist. Usually your surgeon will bring in whoever they're comfortable with or whoever they're used to working with. And actually that's the way to have it, because your surgeon and the anesthesiologist are a team. You want two people who know each other's moves.
Now, you're talking about choosing. There are different kinds of anesthesia. Tell me a little bit about that, and how do you get a chance to choose what you want when you're going under?
Sometimes you do. I mean, in some procedures, you don't have to go to sleep. You don't have to have general anesthesia. They can give you a spinal where they anesthetize, put to sleep just the nerves, for instance, that go down the lower part of your back. So your groin, for instance, for a hernia operation, you don't have to go to sleep for. Sometimes there is a choice. You may say, you know, I really don't want to know from anything. Still, you could have the spinal, but they would sedate you so that you would kind of drift gently through the procedure.
Just count back.